Welcome to Mountain Health Today. I'm Ted Owens, your host, and this program is brought to you by the Tahoe Forest Health System. Today we'll be speaking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, good to see you. How are you?
Doing great. It's great to spend a few moments with you.
Harry, today let's talk about physical therapy and rehabilitation at the Tahoe Forest Health System. My understanding is that you have a rather robust and unique service line there. Why don't you share with us what makes it so?
Yes, this is really an exceptional, rare, large, and quite specialized physical therapy and rehab program at Tahoe Forest Health System that operates in several different locations. The size of it and the skill set wouldn't typically be found even in very large medical centers, but we've found a need as we've been responsive to the needs within our community to develop a large team that's more than 100 individuals to really respond to the rehabilitative needs of our patients here within the Lake Tahoe region. And so they're really experts at analyzing the movement and functions of our patients. And also really their real big focus is on helping our community individuals to really maintain that active, independent lifestyle that we all desire to really enjoy this beautiful region.
Well, and I think that speaks volumes right there, because I know that the communities that you serve, most people are very active in a variety of ways that they may not be in a more urban setting, given just the environment. Let's talk about your physical therapy team's goal. What drives them? What's their culture?
As we see each patient, our foundational goals really are to get our patients back to being able to perform their favorite sport or sports, back to their job that they love, and especially back to an independent lifestyle where they can truly take care of all of their individual needs as quickly as possible. So that's at the foundation of everything we do. And it's a very hands-on approach with every single patient. And they're always excited to develop that individualized treatment plan to help us achieve those goals.
And what type of, in a treatment plan, what type of things do they try to solve?
They first really look at, what are the symptoms, and we want to be able to relieve those symptoms that are causing the problem. We, of course, really want to understand their health status and how and where we need to improve their health status, how we can help their physical abilities, and really return them to a healthy lifestyle, and maybe in many cases even better than it was before.
Well, I've enjoyed the physical therapy program myself, so I know that it's outstanding, and they do a wonderful job, and that's really one of the more important components to healing, particularly after maybe a shoulder surgery or a knee or a hip. What other type of therapists have you that specialize in the program?
We're really pleased to have several subspecialties within physical therapy, and one of those is hand therapy, and this is a very specialized skill set. Many individuals have hand-related injuries. I personally had that myself several years ago, so I saw the great benefits of that, and this really can focus. They're very skilled at dealing with rehabilitating our hand, our fingers, our wrist function, elbow, and shoulder, and so that's all really connected to hand therapy as one important specialty. And so they're using, again, those specialized skills to assess, plan, and then treat those illnesses that relate to hand.
What type of illnesses, for lack of a better word, would be associated with a hand?
Sure, it can be some partial list would be they could have had a fracture or dislocation. I happen to have both of those at one time in the past. Tendonitis, arthritis, tendon injuries, carpal tunnel syndrome, and trigger fingers, just a few.
Well, you hit on one I've had, trigger finger. But you also have, and I think this is unusual because I don't think folks would think this would exist in a physical therapy environment, but speech therapy.
That's correct. Speech therapy is a super important program that, again, can not only deal just with speech, but let's say a person has had something physiologically or neurologically happen that is not only affecting speech, but maybe how they swallow, how they breathe, etc. And so we have skilled individuals to assist with all of those segments of health recovery.
Harry, these are these all referral programs, or can one seek care without a referral in the physical therapy service line?
That's a great question. And typically, a patient who's going to see a physical therapist or a hand therapist or a speech therapist would have a physician order that would send them to one of these professionals in our rehab program.
Okay, we'll come back to that in a moment. We're going to take a break. You're watching Mountain Health Today, brought to you by the Tahoe Forest Health System. I'm Ted Owens, and today we're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. We've been talking about physical therapy and rehabilitation at the Tahoe Forest Health System. We've got much more to come on that subject matter, and we'll be back in just a moment. Thank you very much for tuning in. And welcome back to Mountain Health Today. I'm Ted Owens, your host, and I'm speaking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, we've been talking about physical therapy service line at Tahoe Forest Health System, a very robust program, and with a boatload of experts in a variety of different types of physical therapy. Let's touch on occupational therapy and the services that are provided in that segment.
Occupational therapy is a large and very, very important program for many individuals. It's probably underestimated by the public to be as big as it is. And here in this program, we have specialists that, and again, based on a physician order, based on some physical or neurological challenges that might have occurred, we have occupational therapists that can really focus and improve just daily life conditions, quality of life. And I'll start off with children a little bit. Our occupational therapists can actually help children who might have a disability of one or more types to, just enjoy life at home and to participate better in a school environment and in other social settings, which is great for the child, their mental outlook, their physical development, and certainly helps their parents a lot. And it does include educational components for their parents as well. Occupational therapy can also deal with helping people recover from an injury to really regain the skill of living independently in all those ways that we need to be independent. And we don't realize how much we lost independence until we might have one of these illnesses or injuries.
That's right. That's right. Now, Harry, my understanding is that not all of these services are necessarily provided in the physical plant where PT is located. Is that true? And share with us what types of services might occur elsewhere.
Right. We not only just in our facilities, And we offer services that include evaluations at the patient's home. We do it in the workplace. We do it in the school. We also look for maybe specialized equipment that can help out in a school or workplace setting, and the training on how to use that, and then guidance and education for family members in addition to the patient or the caregiver, so that there is maximum benefit from that.
Now, you had mentioned independence and the importance of independence, both for children and adult patients. And you kind of touched on neurological rehabilitation. Share with us a little bit more about that, and what it is and why it is important.
It's really important. Even sometimes individuals might be experiencing physical or cognitive decline. We can help with that, and also specific to what you just asked, we have an important neurological rehabilitation program that really, again, focuses in on, as we have these neurological issues that arise, we often lose independence, and we need to be re-educated how to do certain body functions that we used to do without thinking. And so they help us re-educate, ourselves to do those things which we just took automatically in life, those daily skills, and what is the process, how to treat it, how to adapt to it, etc.
And Harry, these could be neurological issues caused by a stroke or a brain injury or maybe Parkinson's and other types of ailments, correct?
That's correct. Those are several of the common causes that could cause a patient to really need to be retaught how to do things they did without thinking. Yes, those are common.
Harry, let's talk a little bit about inpatient physical therapy. You've got quite a therapeutic program. Could you share with us a little bit about that?
Yes, we have this very large multi-site outpatient program, but we do have an inpatient acute care hospital, and we have a long-term skilled nursing facility in the Truckee area. And so inpatient physical therapy is really critically important for injuries or certain other relevant conditions. And so our physical therapy team provides therapeutic services to inpatients during their hospitalization. Typically, it might be post-operative to some types of situations, especially in the situation if they've had a total joint replacement. That's a very common item or area of help. Or they've had a traumatic injury and patients hospitalized with some type of significant illness.
Harry, we've got about a minute left in this segment. I wanted to touch on wound care services. Those are also provided.
Yes, there are a moderate percentage of patients out there that suffer from very challenging wound issues where there could be a wound that just, it's not healing, on a chronic basis for some period of time or another cause. And so it's really important to have wound care services right here in our local community. Again, this is really rare in a rural setting. And so this can be relative to diabetic foot ulcers, infected wounds that require sharp debridement, etc.
Thank you, Harry. We're going to take a break. You're watching Mountain Health Today. We'll be back in just a moment. And welcome back to Mountain Health Today. I'm Ted Owens, and I'm speaking with Harry Weiss, President and CEO of the Tahoe Forest Health System. We're talking about physical therapy today. Harry, we left off, you had described the wound care services that are available. Let's move into pediatric therapy services. What does the program look like?
It's also quite rare to have skilled physical therapists that are comfortable with pediatric age patients and adult patients. And so here we're talking about pediatric services. And again, we offer really the full array of occupational therapy, physical therapy, and speech therapy services for all children's ages and a wide variety of challenges and conditions. And that's really rare and special within our community.
I would say so. These are services that I would think would be very unusual, but apparently it's probably overlooked in many communities. Fair statement?
It is, and even though they're young and they may recover quicker than us as adults, they still have all of those same physical therapy or occupational therapy needs, or could even have the speech therapy needs that we have as adults.
Well, let's shift gears and talk about a type of therapy that is probably largely unknown by our viewing audience, and that is pelvic floor physical therapy. What is it, and what types of things does it treat?
Right. This is, again, a non-surgical, non-medicinal, very important area of physical therapy that is actually a subspecialty training area in physical therapy. And it really relates to our pelvic floor area for men and women. And what happens over time, and it could happen due to injury or age or other issues, where therapists really need to address muscles, ligaments, and structures in the pelvic area that really support our bowel and bladder function and support other pelvic organs, for optimal health. And this, again, is ordered via physician as a non-surgical, non-medicinal life improvement journey. And it can, for example, pelvic floor issues could illustrate themselves with pelvic pain. There could be urinary symptoms or problems, orthopedic pain. Another cause of challenges here is pregnancy, and then the postpartum changes after pregnancy. There could also be a situation where there's been prostate surgery or cancer, and that would impact this, and maybe even the treatments of the cancer for that area. And then also even GI or other bowel symptoms. So it's a great specialty area to focus in on non-surgically and non-medicinally.
Harry, I also understand there's an educational component to physical therapy. Share with us a little bit of how that relates and what it's intended to do.
Right. Every patient that comes to our physical therapy and rehab program, education is a huge component to our therapies. And it could be that they sit down and they educate us about the topic in general, but then it might be that we're actually re-educating that area of our body to function the way it used to function before injury or surgery.
I know that not all physical therapy takes place in the physical plant, but you've got to be educated and continue your own physical therapy at home if you really want success. What does a typical course of treatment look like?
Probably every patient includes approximately 5 elements to a great outcome. First is the evaluation by our therapy team to understand all of the challenges that are present. And then number 2 is the treatment. What are those actions that the therapist is going to take in a customized way for our patients? And this could be a single treatment or many treatments. Then there's education, again, for the patient. And then another part that some of us don't like is a thoughtful home exercise program where we practice what we've learned. And again, related to that is our ownership, our involvement as a patient in each step of the process to really help assure we're going to have a great outcome.
So I think I want to hit on that a little bit more because outcomes, particularly from a surgery or an injury, can be really improved by physical therapy. But there has to be a commitment on the part of the patient as well to do the work. Fair statement. Did you commit to do the work at home? And what type of things are we talking about? What type of home therapies are they recommending that a patient,
Depending on the illness or the surgery, our therapist will provide a set of very custom exercises and how many sets that they would do of that each day, and approximately for how many weeks that needs to be done, so that we train the body to function and we develop the strength that we need to have the great active lifestyle we all desire.
Harry, we have about 30 seconds left. Where are physical therapy services located?
We have them in Tahoe City, we have it in Incline Village, and also in Truckee, California.
And for more information, go to tfhd.com. You're watching Mountain Health Today. I'm Ted Owens and my guest, Harry Weiss from the Tahoe Forest Health System. Thank you for tuning in.